repeated and intense sexual fantasies, cravings, or actions involving observing an unsuspecting person undressing, having sex, or engaging in sexual activity for at least 6 months. Causing distress or interpersonal problems. A. Frauderism. B. Exhibitionism. C. Voyeurism. Which of the following is a long-term aim rather than a pressing concern? A. Comprehensive psychological evaluation to determine the type and severity of ADHD. B. Parents establish clear, consistent limitations and uphold healthy parent-child boundaries. It is used to identify traits that best characterize a person's preferences or propensities in social, professional, and academic contexts. A. What is a vocational preference instrument? B. What is the humanistic behavior model? C. What is the criterion for a delirium diagnosis? Lee is concerned about her ability to pay. Which of the following is not true in regard to counselor code of ethics? A. In establishing fees for professional counseling services, counselors consider the financial status of clients and locality. B. Counselors do not have to discuss payment during informed consent since it may change during treatment. An important area to gain more information on at this point is A. Cultural factors. B. Source of anxiety. C. Social support. D. Financial situation. In her first session, Lee, who came to the U.S. as a nanny, revealed unfulfilled promises of benefits. She faces harsh conditions, including cramped living space, long hours, dietary restrictions, and verbal abuse. The counselor should respond empathetically, exploring Lee's emotions and needs. A. How was it like in your homeland? B. You should not be treated this way. Which of the following steps should the counselor take? A. Give Lee a referral to a shelter. B. Tell her she needs to find another place to live. C. Suggest finding another job. D. Encourage Lee to go to the police. By saying, "Tell me about your experience coming into a new culture and going through what you did," the counselor is demonstrating the attribute of A. Cultural awareness. B. Curiosity. C. Empathy. Lee reported her situation to authorities and sought refuge in a women's shelter, improving her circumstances. Yet, on the subway, encountering someone resembling her past employers triggered intense fear and physical distress. This reaction aligns with A. Panic disorder. B. Panic attack. Lee should be referred to A. A group for human trafficking survivors. B. Employment counselor. C. Care manager. D. All of the above. An effective treatment for anxiety is A. Cardiovascular exercises. B. Cognitive behavioral therapy. C. Benzodiazepines. D. Corticosteroids. A symptom of panic disorder is A. Recurrent panic attacks. B. Persistent worry about panic attacks and maladaptive change for 2 weeks. C. Caused by separation from home or attachment figures. D. Symptoms are only precipitated by social situations. Inadequate lubrication, swelling in reaction to sexual arousal, making it impossible to achieve or maintain until the sexual activity is complete. A. Female-male orgasmic disorder. B. Female sexual arousal disorder. C. Sexual aversion disorder. As a sign of panic disorder. A. Continuous fear of panic attacks and unfavorable change for 2 weeks due to being away from home or emotional attachments. B. Recurrent panic attacks. C. Only social circumstances can cause symptoms to flare up. A persistent phase of the disorder featuring a major depressive, manic, or mixed episode with continuous delusions or hallucinations for at least 2 weeks, without clear mood indications. A substantial portion of the illness duration involves mood-related issues. A. Brief psychotic disorder. B. Schizoaffective disorder. Jane reported her situation to authorities, sought refuge in a women's shelter, and feels more independent despite unemployment. On the subway, she experienced distress resembling her former coworkers, leading to physical symptoms and assistance from a bystander. A. Panic attack. B. Panic disorder. Which of the following interventions is likely to be beneficial for managing bipolar II disorder, particularly addressing sleep dysregulation and poor eating habits? A. Pharmacotherapy and CBT. B. Behavioral Activation System, BAS, and interpersonal social rhythm therapy. Which therapeutic approach is likely to be effective in addressing agoraphobia disorder by incorporating situational exposure, homework, and stress inoculation? A. Mindfulness and thought to stop. B. Bibliotherapy and positive self-statements. C. Systematic desensitization and relaxation training. Which therapeutic approach is commonly employed for addressing alcohol use-related issues, incorporating techniques such as cognitive restructuring, relapse prevention, and cue exposure for dependence? A. Supportive expressive therapy and exposure prevention. B. Cognitive behavioral and self-control training. Which tic disorder is diagnosed when both motor and phonic tics are present for more than a year, according to the DSM-5? A. Chronic tic disorder. B. Transient tic disorder. C. Tourette's syndrome. Which of the following is a characteristic of Tourette's disorder, involving involuntary, sudden, brief, intermittent, and repetitive movements or sounds? A. Prolonged and sustained tics. B. Voluntary and intentional movements. C. Clonic and dystonic tics. What is included in the category of schizophrenia spectrum disorders, characterized by abnormalities such as delusions, hallucinations, disorganized speech, abnormal motor behaviors, and negative symptoms? A. Bipolar I disorder and schizoaffective disorder. B. Schizotypical personality disorder and delusional disorder. Which phase associated with schizophrenia involves low-grade symptoms that gradually emerge before the onset of psychosis and may include loss of interest in work, social activities, and personal appearance, as well as symptoms like blunting, apathy, and paucity of speech? A. Residual phase. B. Prodromal period, prodrome. What treatment is recommended to assist in reducing masking for crowding acuity and contrast sensitivity in individuals with schizophrenia, according to research? A. Cognitive behavioral therapy. B. Video action games. C. Pharmacotherapy. According to research by Hemsley and Murray, 2000. What is the primary focus of psychosocial skills training, SST, for individuals with a deficit syndrome characterized by cognitive impairment and social difficulties? A. Rapid presentation and intensive learning. B. Slow rate of presentation and part learning method. What does cognitive behavior therapy, CBT, primarily target in individuals with schizophrenia? A. Level of thought disorder. B. Coping adaptive strategies. C. Positive auditory symptoms. What is the primary goal of compassion-focused therapy, CFT, in the context of schizophrenia treatment? A. Reduction in paranoia and negative emotions. B. Increase in shame, anger, and sadness. C. Enhancement of auditory hallucinations. D. Improvement of cognitive disturbances. What are the three skill development components addressed by integrated psychological therapy, IPT? A. Neurocognitive interventions, social skills, and verbal communication. B. Interpersonal problem solving, social skills, and cognitive differentiation. In the context of brief psychotic disorder, which of the following is a requirement according to criterion A? A. Presence of at least 1 day but less than 1 month of psychotic symptoms. B. Presence of delusions, hallucinations, disorganized speech, or grossly disorganized or catatonic behavior. Which of the following is a distinguishing feature of the catatonia specifier? A. Presence of at least 3 of the 12 characteristic symptoms. B. Excessive motor activity provoked by external stimuli. C. Predominance of at least 1 of the 12 symptoms. How does the DSM-5 define delusional disorder in terms of the nature of delusions? A. Delusions must be non-bizarre and fixed false beliefs. B. Delusions must be bizarre and resistant to empirical disconfirmation. C. Delusions can be either bizarre or non-bizarre. Why are bipolar and related disorders separated from depressive disorders in the DSM-5? A. Due to differences in prevalence rates. B. As a bridge or link between the schizophrenia spectrum and psychotic and depressive disorders. C. To simplify diagnostic criteria. What additional emphasis has been placed for diagnosing bipolar disorders? A. Emphasis on the severity of depressive symptoms. B. Emphasis on cognitive distortions. C. Emphasis on activity and energy. D. Emphasis on family history. What is the primary criterion for diagnosing bipolar I disorder? A. Presence of depressive symptoms. B. Presence of hypomanic symptoms. C. Presence of a manic episode. D. Presence of family discord. What characterizes bipolar II disorder? A. Presence of at least one episode of mania and one or more major depressive episodes. B. Presence of at least one episode of hypomania and one or more major depressive episodes. C. Presence of only manic episodes. Which of the following is a characteristic of individuals with elevated mood, mania? A. Loss of energy and interest. B. Diminished sleep and excessive energy. C. Concentration problems and guilt feelings. D. Symptoms of anxiety and obsessions. What percentage of workplace absenteeism is accounted for by depression? A. 11%. B. 25%. C. 40%. D. 50%. What was the term used in the DSM-IV for what is now referred to as persistent depressive disorder, PDD? A. Neurotic depression. B. Dysthymic disorder. C. Depressive neurosis. D. Ill-humored disorder. What are the typical signs and symptoms of normal grief? A. Prolonged and marked functional impairment. B. Morbid preoccupation with worthlessness. C. Feelings of sadness, preoccupation with thoughts about the deceased, tearfulness, irritability, insomnia, and difficulties in concentrating and carrying out daily activities. Which of the following disorders is no longer classified under anxiety disorders, according to the American Psychological Association? A. Generalized anxiety disorder. B. Obsessive-compulsive disorder, OCD. C. Post-traumatic stress disorder, PTSD. According to the criteria for separation anxiety disorder, what is the minimum duration of the fear or anxiety concerning separation for adults? A. 2 weeks. B. 4 weeks. C. 6 months. What is a typical characteristic of social phobia? A. Fearlessness. B. Overconfidence. C. Self-consciousness. D. Recklessness. What is a characteristic of panic disorder? A. Gradual onset of fear. B. Predictable panic attacks. C. Prolonged period of discomfort. D. Sudden surge of intense fear. What is a key characteristic of generalized anxiety disorder, GAD? A. Brief and episodic worry. B. Panic attacks with specific triggers. C. Chronic and uncontrollable worry. D. Fear limited to social situations. What are the 4 types of obsessive-compulsive disorder, OCD, symptoms? A. Anxiety, body dysmorphic, hoarding, hair pulling. B. Contamination, symmetry, harm, taboo content. C. Panic attacks, phobias, social anxiety, generalized anxiety. D. Depression, impulsivity, irritability, emotional dysregulation. What is body dysmorphic disorder, and what are some of the behaviors associated with this disorder? A. A fear of social situations and public scrutiny. B. Intense fear of specific objects or situations. C. Preoccupation with perceived defects or flaws in appearance. What are the criteria for diagnosing hoarding disorder according to the DSM-5? A. A fear of social situations and public scrutiny. B. Persistent difficulty discarding possessions, perceived need to have items, and distress associated with parting. C. Intense fear of specific objects or situations.